Thank you, Mr. Speaker. My question is to the Minister for Health. How is the Albanese Labor government undoing previous attack on Medicare and making it easier for Australians to see a doctor?
Call to the Minister for Health and Aged Care.
Thank you, Mr. Speaker. And I thank the member for Tangi for his question, because he knows after 9 years of cuts and neglect to Medicare, it has never been harder than it is today to see a doctor. And he also knows the pressure on bulk billing rates in WA, because they are some of the most severe anywhere in the country. That's why he campaigned so hard, Mr. Speaker, on our promise to strengthen Medicare. And our budget 2 weeks ago delivered on that promise, with $6 billion in new investments to strengthen Medicare, including the centrepiece, an initiative to triple the bulk billing incentive, what we describe in Labor as the beating heart of Medicare. I was delighted, Mr. Speaker, to have the opportunity last week to meet with the member for Tangi and a number of doctors in Willetton in his electorate and talk about the difference that that initiative would make to the 74,000 people who live in his electorate who are eligible for bulk billing incentives. But the member for Tangi also knows, Mr. Speaker, that the challenge in finding a doctor is often the most acute when someone in your family needs urgent care, when your kid falls off the skateboard and breaks their arm, when there's a deep laceration that needs urgent stitching, these non-life-threatening emergencies that could quite adequately be dealt with out in the community in a primary care setting. Instead, Mr. Speaker, though, we know that every year in Australia there are more than 4 million presentations to emergency departments classified as non-urgent or semi-urgent, many of which could be dealt with in a primary care setting. This means more pressure on hospital emergency departments. It means patients waiting for hours and hours to get treatment they should be able to get in the community. And Mr. Speaker, that is why Labor committed to funding 50 urgent care clinics across Australia, including one around Murdoch in the member for Tangi's electorate, open 7 days a week, extended hours from 8 a.m. to 10 p.m, open for walk-in patients and, Mr. Speaker, most importantly, fully bulk billed. All you have to take is your Medicare card. And last week I visited the first site in Perth with the Minister for Early Childhood and the Assistant Minister to the Prime Minister, and over coming weeks more sites will be announced, with all 58 clinics now up and delivering services over the course of this year, which we promised in the election. We've received huge support from states and territories who are now driving many of the expression of interest processes, and huge interest in general practices that want to take their practice to the next level, Mr. Speaker, and submitting tenders under this process. Mr. Speaker, our network of fully bulk billed urgent care clinics are going to make it easier to get the care you need when you need it out in the community. They're going to take pressure off hospital emergency departments across Australia. It's all part of Labor's plan to strengthen Medicare.